I'm Jeff Pospisil, the 10-Minute Treasurer with practical advice for improving your church's financial future. In this video, I'm going to talk about how a church can legally reimburse employee health costs. So a lot of churches, they're stuck because they're too small really to offer a group health plan, but they probably still have employees that would like some kind of health benefit. And so how is there a way to do a reimbursement where you can control the costs and you don't have to deal with all the overhead type of stuff? You may not remember this, but prior to 2010, reimbursing health costs or providing some kind of a stipend was one of the most common ways that churches provided health benefits, especially for their lay employees. But then something changed. And the big change was that Obamacare happened. And Obamacare all of a sudden made those health stipends and health reimbursement relationships, those became taxable. And so all of a sudden, $1,000 became $700 because the government decided to take 30%. So, and there was good reasons for this. They wanted people to explore the marketplaces and all that kind of stuff. But either way, churches kind of got the short end of the stick with Obamacare in a lot of ways. So right before President Obama left office, there was this act that passed that allowed what's called QSEHRA. So Qualified Small Employee Health Reimbursement Arrangement, QSEHRA. And QSEHRA is probably, I think, pretty much the only legal way for churches to go ahead and do some kind of a health reimbursement benefit for their employees. And I'm just going to talk about it and give you some of the details and see if you want to explore that. So who actually is eligible for QSEHRA? If you're a church, you have to have under 50 full-time employees and no group health plan. So practically every church is eligible because very few have more than 50 full-time employees, and you either don't have a group health plan or you want to get rid of your group health plan, and that's why you're looking into this. For employees, the employee does have to be covered by an insurance plan. So an actual insurance plan. The Medi-Share plans, those faith-based ones don't count, but Medicare, Medicaid, TRICARE, your spouse's plan, those all do count. They have to be willing to submit reimbursements. This is not a stipend. This is a reimbursement. So they have to be willing and able to submit those reimbursements. And lastly, all full-time employees would automatically be included in this, but part-timers and seasonal people, those are not necessarily eligible unless the church decides to include them. And kind of interesting, in the Dakotas, we consider full-time usually 40 hours per week. Most of the rest of the world says full-timers are 30 plus hours per week. So that's what's built into the law. So if you have somebody that's 30 plus hours per week, they are full-time for this. Now, the one question I still kind of have is about the pastor. What about the pastor? Is the pastor eligible or required to participate in QSEHRA if the denomination already has them as part of their denominational health plan? Very similar. Most of our pastors here on HealthFlex, would they be required or eligible to get into this reimbursement business? And here is my best guess. My best guess is that no, because pastors it's weird. Their employment status is so fuzzy. Um, the Social Security Administration considers them self-employed. The IRS considers them employees of the church. And for health insurance purposes, for the most part, we consider them employees of the conference or the denomination. So that is my best guess, is that they would not be eligible for QSEHRA unless they're not on the denomination's plan. So if you're going to go down this QSEHRA route and you're going to decide that you want to do this for your health benefits, you have to decide. The first one is, do you want to include part-timers? Do you want to include part-timers, or is this just for full-timers, which is 30 plus hours per week? So the pastor's already excluded, but a lot of churches, they'll have maybe a full-time office person and another program person that's full-time. So, but then when you start looking at the part-timers, that really opens it up, because you'll have various ones. Churches are usually flooded with part-time workers of all different types. And The kicker is you could have a quarter-time youth person, for example, and they get the same dollar amount as a full-time person. There's no reduction, or it's not prorated based on your hours or anything like that. It is all or nothing. So if you include part-timers, they all get that full benefit. So that is a big decision. The next big decision after you decide if you want to include part-timers or not is deciding what amount you want to reimburse. What is that going to be capped at? The federal government gives annually, they give the maximum amount. And so for 2020, for a single, it's 5,250. For a family, it's 10,600. So your first decision is, well, do we want to cover the maximum or a lesser amount? And maybe it's a percentage. Maybe we say we want to cover 50% of the maximum, or we want to do a certain dollar amount. Maybe it's $2,000 for singles and $4,000 for a family. You know, you have that latitude to make that decision if you want to do a lesser amount and cap it. The other thing is maybe do you want to give everybody the same, and you really don't care if a person has a family or anything else. You just want to give $2,000 per employee, and that way you can kind of control your costs that way. Does family size matter? Sometimes some churches will be sensitive to this and say, well, maybe a single person gets 2,000 and a family with kids that are at home gets 4,000, and then if it's just a married couple, they get 3,000. You're able to discriminate like that. And the other thing too, does age matter? You're allowed to discriminate like that as well. So a lot of times older employees will have more costs than younger employees. So um, basically they respect that 3-to-1 ratio. So if you have a 26-year-old, you can pay them, let's say a max of one, let's say you set it at 1,000. That means your 64-year-old can get 3,000, and then there's basically a sliding scale. So you got to do some math here, and if you had a fancy spreadsheet, you can do it. So, but you do have to make those decisions. Does age matter? Family size? Are we going to do a percent? Are we going to offer everybody the same? The next big decision to make is, do we want to manage this program, administer it ourselves, or do we want to get a TPA, which is a third party administrator? For most of these resources, I borrowed from or took off of Take Command Health, and they seem like a good company, and they'd be one that I know offers this service they could administer for you. And one of the good reasons that you might want to go with a third party is that way you don't have to see people's medical stuff. I mean, I don't really want to know if my uh, employee has a prescription for Viagra or whatever it is. I just really don't know if I need to know that. And would it influence my interactions with them? So, and maybe that's just me as an awkward accountant, but that would be part of the reason why I might be consider paying for a third party to administer it. My cheap side says I should do it myself. My part that is uncomfortable with people says let them do it. And another reason why you might want to include having a third-party administrator is because the plan document. You're required to have a plan document, and a third party will help you put that together. If you want to do this yourself, I've included a template in the comments, or in the description of this, so you'll be able to click on that and fill it out yourself. I really didn't look at it that closely but there was a bunch of blanks to fill out, and you can kind of pick out where your decision points are. If I ever have time, I'll update it and make that easier to fill out. All right. Hopefully that helps you. It's kind of a lot, but this was a subject that I keep returning to, and I want to remember it because it's that kind of loophole law that I think could be valuable for churches. But it also is something that you could screw up pretty big. And since not many of us are aware of it, I think that's why it's so easy to screw up. So hope you like this. This is Ministry of the Finance Office of the Dakotas Conference of the United Methodist Church, as well as the Dakotas United Methodist Foundation. Find all of our stuff at www.dakotasumc.org, and like, subscribe, share if you found this helpful, or leave an encouraging comment. All right, till next time.